Guinea confirmed the return of the deceased to the country following the reporting of 7 cases and the deaths of 3 people at the weekend. Earlier today, former Minister of Health at the time of the Ebola outbreak, Omar Sy, spoke to the Fatu Network on how his ministry handled the Ebola outbreak at the time.
It's very, very simple. Anything you do, you must have a plan. You have a plan, strategy plan, then you have an operational plan based on what you need. Then you implement the plan according to international health regulations. It's a very simple strategy, and it's cross-cutting across the board. In response, epidemic response, there are 7 different components. Now you have your team, then you get these 7 different components. That is like the laboratory services, logistics, case management, risk communication, community engagement, so that everybody get involved. Then you put these structures in place, get the rightful people there, and then you don't sit in city, you move out, you go around in the regions also. You establish similar structures so that you can cascade, you can pass on the same structures. So that, that's all what you need to do.
Former minister advised the Korean Ministry of Health on ways to prevent any importation of Ebola.
Gambia is signatory to the International Health Regulations 2005, and we must adhere to that. So we have to work through the network, through the WHO office in the Gambia. But notwithstanding, the Gambia must have a plan. During the Ebola, we had a plan that must have expired now. But just before the end of the Ebola in the Gambia, we developed what we call all hazards plan. And that plan has some components that can be used to try and look for, to adapt to the current situation. And then we move on. What is most important in this, in this intervention is preventive. And this one, they have been my emphasis, even with the COVID. We must go preventive. You don't wait for people to get sick and you start treating them. You have to learn to prevent people from getting sick. And that is enforcing risk communication and community engagement. If that one fails, then that's where we have a problem. That's why you can see now the trust is not there. One, people are not adhering to COVID regulations. If you want to force them, it's not. Because it's the level of understanding. That's why the risk communication and community engagement component, so people to believe in it, to have ownership of it, that is very important. It's a key factor.
With the issue of his expertise in the field, Sy says he is always on the move to contribute in the health sector.
I don't wait for government to ask for them. What I do is I contribute to in my own ways. If I have people where I can mobilize resources, I will direct them to the right places. If I see interventions, I intervene, and I help. But I also want to take the back seat, because it's not about an individual, it's about a nation, it's about a group of people. So I contribute in programs, directly or indirectly, where I like to take back seat always.
The Gambia government has told the Fatu Network there is already a plan in place. Fadu Kamara reporting for the Fatu Network News Review.